Hello, it's Bruce Williams again, and it's Friday morning, so it's time for Gross Path Challenge number 4. Grab a pencil and a piece of paper, and let's look at about 10 classic images from 1992, my first year here as the training officer at the Joint Pathology Center. What kind of person would start a test off with a gerbil? Well, that's where we are, and I need you to give me the morphologic diagnosis. Okay, time's up. This is an adenocarcinoma of the ventral marking gland of the gerbil. Hamsters and gerbils have prominent marking glands which are modified sebaceous glands. Hamsters have paired marking glands on their back on either side of the lumbar spine, which not only use for marking but also have a processing role in the processing of testosterone. Gerbils, on the other hand, simply have a single marking gland on their abdomen in the center, and it doesn't have any function other than marking, and of course, making the occasional neoplasm. This is an old picture, and a pretty good example of why red backgrounds are probably your not best choice when doing gross pathology work. Slide number 2 is a foal, and I'd like for you to name this condition. Okay, the condition name is epitheliogenesis imperfecta. An appropriate morphologic diagnosis, which I don't often ask for, because people always give me the condition name, anyhow, would be multifocal to coalescing epidermal loss. Okay, it's epidermal loss. The skin was there, but because these animals have a defect in a substance known as laminin 5, often during the birth process or shortly afterwards, the epidermis loses its connection to the underlying dermis and sloughs off. A lot of times this happens during the birth process. Laminin 5 is an important component of hemidesmosomes, and hemidesmosomes are what anchors the basal layer of the epithelium to the underlying basement membrane. If they don't work in areas of friction, the epidermis will come off. Another common area that you will see epithelial loss in these animals is the tongue, because even in utero, the foal will make sucking motions, and this will be enough to disrupt that epithelium from the underlying basement membrane, and you'll lose sheets of epithelium. Are you ready for another? Okay, this is tissue from a dog. I want you to give me a morphologic diagnosis and a cause. Okay, time's up. We're looking at the underside of the tongue of this dog, and the morphologic diagnosis is bilateral. If you want to say bilaterally symmetrical, I would take that as well, and I'll tell you why in a minute. Bilateral, multifocal to coalescing ulcerative glossitis. If you told me lingual ulcers, I will take that for full credit. The cause of this condition is uremia. Let's start with the importance of a bilaterally symmetrical lesion. When you see paired lesions on either side of the midline, that's not a bacterial lesion, that's not a viral lesion, those tend to be much more random. Conditions that hit similar structures on either side of the midline are usually associated with either metabolic or toxic causes. And in this case, uremia was the cause. These ulcers don't have to be bilateral, but they often are. Now, there are 2 distinct lesions that happen in the tongue, and we're looking at one of them in association with uremia. tell you a story about the underside of the tongue. In uremia, we're going to ignore the abnormalities associated with calcium phosphorus retention and concentrate on the elevated levels of blood urea nitrogen in the blood level. And that does a couple things. When an animal has a tremendous amount of urea nitrogen in its blood, we know that its breath is going to smell like ammonia. And that occurs because in the mouth, that urea nitrogen will exude through the mucosa and mix with the saliva, which accumulates underneath the tongue. And normal commensal bacteria will split the urea in it and results in ammonia. And so the underside of the tongue here is actually sitting in an ammonia bath, and that is why we get the ulcerations under the tongue. Now, extra credit if you know the other lesion that is commonly seen in the tongue with uremia. Did you know that infarcts of the tongue, especially of the tip of the tongue, are very common in uremia? Because one of the things that high levels of uremia do is that they are toxic for endothelial cells. And when the uremia gets high enough, you'll get hemorrhages throughout the body, especially in the oral cavity and the stomach. And you'll have hemorrhage, thrombosis, and because you have one arterial going to the tip of the tongue, if you cause endothelial necrosis and thrombosis there, you're going to infarct the tip of the tongue. If that animal survives, it may slough the end of the tongue. Generally, because these animals are in chronic renal failure, they don't survive. So look for 2 lesions in the tongue in animals presented in chronic renal failure for autopsy. Okay, that's a great story. Let's go on to slide number 4. Slide number 4 is a little red, but this picture was taken at the AFIP many years before any of us were born. So, this is from a trout. I would like a morphologic diagnosis and a cause. Okay, time's up. Before we look at the morphologic diagnosis, something that you'll probably never see, that those of us who learned pathology in the 70s and 80s learned was when you take Kodachromes, and all of these images were taken from Kodachromes, and you dupe them over and over and over, and they go all over the country, and hundreds of duplicates were made from good images. They tend to get this sort of pinkish, washed out look. So we know that this image was one of hundreds that was made, and we got one of the last ones, certainly not the first one. Okay, so we are looking at the liver of a trout, and this is a hepatoma. And the cause for this is aflatoxicosis. If you said cottonseed meal or gossypol, I'm giving you full credit. You really know your fish cancer. But back in the late 60s, when these experiments were conducted, it was finally determined that gossypol probably enhanced the carcinogenic effects of aflatoxin on the liver. But I'm going to give you credit for gossypol. The association between aflatoxin and liver tumors in fish was made back in the 1960s, well before we knew about the many ways that aflatoxin could damage the liver, especially in the area of carcinogenicity. Aflatoxin will intercalate into nuclear and mitochondrial DNA and form adducts with guanosine. The end result of this is inactivation of the tumor suppressor gene p53 and the inability to prevent the propagation of genetically damaged cells. Aflatoxin has been associated with a wide range of species and a number of different types of tumors in the liver. In fish, it will cause hepatomas or hepatocellular carcinomas, and it often causes hepatocellular carcinomas in mammals as well. In ducks and hamsters, it results in cholangiocarcinomas. In cattle, it'll cause tumors of the nasal mucosa, carcinoma of the esophagus and stomach in rats, and carcinoma of the lung in rabbits and mice. Okay, we're moving on. Oh, we've got a lot of exotics in this region of the test. Okay, as you can read below, this is tissue from a python. I would like to have a good morphologic diagnosis, an etiologic diagnosis, that's two words, it's the organ and the agent, and then the cause of this lesion. If you want, you can give me the common name for this condition. Okay, time's up. We can see a fibrinonecrotic membrane affecting much of the oral cavity of this python. Morphologic diagnosis, you can go a number of different ways. This is a multifocal to coalescing necrotizing stomatitis. If you called it a diffuse fibrinonecrotic stomatitis, I will take that just as well. Just remember to get the necrotizing part in there. The common name for this condition is mouth rot, although a lot of people will call it necrotic stomatitis. The cause of this condition is associated, it could be any gram-negative organism, but the two that are most commonly associated historically with this condition are Aeromonas hydrophila or Pseudomonas aeruginosa, and all of those, both of those would be perfectly fine. Remember, the etiologic diagnosis, a combination of the site and the agent, would be oral aeromoniasis or oral pseudomoniasis. Okay, let's move on. Slide number 7 is a great picture from the AFIP many years ago, and this is tissue from a cat. I'd like for you to give me the morphologic diagnosis and the cause of this lesion. Okay, time's up. I hope you're able to get oriented on this lesion. This is the spleen from a cat. Here we have the heart, rib cage. Looks like a kidney here. And all of this yellow, hard material. I can tell you that if you walked into the room while this cat was being autopsied, the whole place would smell like fish. And that's probably what this cat was eating. Some type of rancid fish diet. The morphologic diagnosis is a diffuse, severe, subcutaneous, and mesenteric, even omental, necrotizing steatitis. There is fat necrosis affecting every bit of fat in this animal's body. Look at all the subcutaneous fat. It's undergoing the exact same changes as that in the abdomen. There's probably significant effusion here as well. Even the pericardial fat is affected. The cause for this is vitamin E deficiency. This animal was eating a diet that was high in unsaturated fatty acids. It exhausted all of the vitamin E in the body and probably was not eating a balanced diet with no vitamin supplementation, so it was very deficient in vitamin E. And the breakdown of these fatty acids resulted in excessive productions of antioxidants, and it became a vicious cycle. And so we have necrotizing steatitis throughout the entire body. Okay, let's move on. Slide number 8 is a classic. And this is tissue from an ox, and all I want you to do is give me the morphologic diagnosis. Okay, time's up. Hopefully you recognize that we are looking at the diaphragmatic surface of the liver. It's not very crisp because the capsule is still on it. We have some reflections on the capsule. As we look through the capsule, we can see these multifocal dark depressions. This is a very common incidental finding in cattle known as hepatic telangiectasia. And these depressions are simply areas of loss of hepatocytes with pooling of blood. It's an incidental finding. It doesn't mean anything. It shows up better when there's a little bit of the fat in the liver. As we see here, the liver's a little orange, so these lesions show up very nicely. This particular condition is also seen in cats. It may be seen in rats and man, where it's known as pileosis rather than telangiectasia or telangiectasis. Ready to move on? Slide number 9 is also from an ox. I would like for you to give me the morphologic diagnosis and the cause. And while you're doing that, I'll give you some good news. I got my numbering off. This is only slide number 8 because the initial slide took up a slot. I apologize for that. So we're on slide number 8. Okay, hope you had enough time. This is also an old picture. Most of these came from the AFIP, which had all the great photographers back in the 50s and 60s, and I recognize this piece of metal ruler. Okay, this is from an ox. We're looking at a formalin-fixed piece of tissue. This happens to be liver. We've taken a cross-section of the liver. The morphologic diagnosis is multifocal or focally extensive sclerosing cholangitis. If you said biliary duct fibrosis, I'm going to give you full credit. These are bile ducts right here. And you can see the tremendous amount of fibrosis around these ducts. Probably in here there's a lot of epithelial hyperplasia, but this white laminated concentric material is fibrous connective tissue. You can even see that these bile ducts would be easily visible from the surface of the liver. This fibrosis courses along the surface of the liver. This is usually associated with an intraductal parasite. You won't see it with the ones that live in the hepatic parenchyma, but the ones that live within the bile ducts. And the most appropriate cause of this would be fasciola hepatica. You can also see it with Dicrocilium dendriticum. Those are much smaller flukes, tend not to cause as much fibrosis. But in the spirit of fairness, I've got to give full credit for that. But I'm looking for fasciola hepatica. Now, this is what you see with the adult parasites. Remember that the migration of the immature flukes may cause other lesions in the liver of the ox, including black disease or hemoglobinuria, bacillary hemoglobinuria, because as they migrate through the parenchyma of the liver, they set up areas of ischemia in which preposition bacilli associated with Clostridium novii or Clostridium hemolyticum are already in there, just waiting for the right environment to do their damage, to proliferate, to form spores. And that usually happens when immature flukes migrate through the parenchyma in large numbers on their way to the bile ducts to form this lesion. Okay, next slide. Another oldie, but a goodie, and this is tissue from a chicken. I would like for you to give me the morphologic diagnosis and the cause. Okay. If you name the condition instead of a morphologic diagnosis, I'm still going to give you full credit. That would be osteopetrosis. Morphologic diagnosis would be diffuse diaphyseal, periosteal, and endosteal new bone growth, or hyperostosis. The name of the condition is osteopetrosis, and it is caused by an alpha retrovirus, also known as avian leukosis virus. Pretty much all chickens have this retrovirus within their genome. And the condition is caused by replication competent strains of avian leukosis virus. Another condition that is thought to inactivate tumor suppressor P53. It's usually seen in birds between 8 and 12 weeks of age, and the same bird may have another manifestation of avian leukosis, the formation of lymphoid tumors throughout the viscera. The mechanism of osteopetrosis is somewhat different between birds and mammals. In chickens, this retrovirus causes altered growth and differentiation of osteoblasts, whereas osteopetrosis in mammals usually results from a genetic defect in osteoclasts. Okay. Our last slide is tissue from a pig. Take a good look. All I'm asking you for is a morphologic diagnosis. Okay, time's up on our last question of the day. It's an older picture, a little bit orange, but hopefully everyone recognized that the vertebral column has been split and bisected. We're looking at the spinal cord, and right here, in between two vertebrae, which you can make out pretty well, there is a focal area of suppurative discospondylitis, inflammation of the intervertebral disc and probably the edges of the vertebral end plates. In swine, although I didn't ask you, this is usually a result of erysipelathrix rhusiopathy, a bacterial agent that circulates in the bloodstream and often causes thrombosis, especially in these areas where blood vessels make sharp turns. Back in the day, Brucella suis would be a good rule out. But we don't see that much anymore. Well, I hope that this little exam starts your weekend off on a good note and not a bad one. I look forward to putting out more of these little quizzes in the future, and I hope that you're getting a little something out of it. Thanks for your attention, and have a great weekend.